Hi everyone. Today we will be discussing childhood obesity and the impact of nutrition intervention during youth. Many of these studies primarily focused on schools and childcare centers in low-income areas. Before we begin, it's important to understand how the CDC defines childhood obesity. Childhood obesity is characterized by a child having a BMI greater than the 95th percentile. So when studies take the stats for childhood obesity, they are following this definition. Childhood obesity is a rising concern in America, and it can affect anyone. However, childhood obesity is primarily affecting rural communities, POC communities, low-income households, and food deserts. All of these groups and communities share one thing in common, and that is their limited access to nutritional foods. So I asked the research question, can nutrition intervention decrease the prevalence of childhood obesity? The first intervention that I studied was the impact of free school meals. Here, the goal was to implement a program called Community Eligibility Provision. This program allows high poverty schools to offer free school meals to all students, regardless if they qualify for a free school meal or not. The goal is to provide adequate nutrition to all students. It's important to acknowledge that the CEP utilizes other programs to ensure that the meals they are providing are nutritionally sufficient for the students and they are receiving good nutrition. The effects of the free school meals. There are many advantages, one of them being that it helped provide adequate nutrition for students. Many students are receiving their nutrition primarily from school, so it's important that the meals they are receiving provide enough nutrition that will satisfy their needs. In addition, after data was taken, 80% of the students did qualify for a free school meal. Therefore, when the CEP was implemented, these students were receiving the meals that they needed and deserved. However, there were some disadvantages. Not all the schools who qualified implemented CEP. This suggests that when CEP was implemented in schools, it benefited the children because they were receiving adequate nutrition and it was accessible for them. There were also some difficulties. The studies were limited to school-aged children in low-income areas in California alone, and data was only taken from 5th, 7th, and 9th graders. However, the overall benefits were that the schools who participated in CEP were associated with a decrease in obesity prevalence. Here we see a graph from the data in the study. The blue dots represent the pre-policy point estimates, and the red dots represent the post-policy point estimates. They are both in association to the obesity prevalence. It's evident that the blue dots are higher than the red dots, suggesting that once schools implemented CEP, there was a decrease in obesity prevalence within those schools. Therefore, the implementation of CEP did help reduce the prevalence of obesity in public schools by ensuring that students were receiving adequate nutrition and steering away from ultra-processed foods. The second type of intervention that I studied was emotional regulation intervention. Here, the goal was to use emotional regulation intervention paired with obesity regulation to decrease the prevalence of obesity-related behaviors. During this study, preschoolers were sorted into 3 groups. Some groups utilized both obesity regulation and emotional regulation, while others used one or the other. The first group included Head Start, Preschool Obesity Prevention Series, and Incredible Years. All of these were intervention methods to help with emotional regulation and obesity-related behaviors. This group saw the biggest improvement, which was associated with improved self-regulation, suggesting that students were using these different intervention methods to regulate themselves during emotional crises instead of using food as their main coping mechanism. The second group included Head Start and Preschool Obesity Prevention Series only, and the third group only included Head Start. These two groups saw no improvement in either emotional regulation or obesity-related behaviors. However, paired with the 3 types of intervention, as well as obesity prevention, there was an improvement in self-regulation and obesity behavior prevention, which saw an overall decrease in the consumption of added sugar beverages. This suggests that with emotional regulation behavior changes and obesity prevention behavior changes, children will learn different coping mechanisms to help soothe themselves during emotional crises instead of turning to ultra-processed foods and sugar-sweetened beverages as a way to soothe themselves. The third type of intervention that I studied was nutrition education. Here, the goal was to use a multi-level nutrition education approach to help low-income families gain knowledge surrounding healthy eating. This was mainly focused in a child care center where both the staff learned about nutrition as well as students and their families. The intervention methods included nutrition promoting activities, food-based classroom nutrition education, and intervention for each level, including the center itself, staff, and children. Throughout these intervention methods, the main focus was to increase the acceptance of fruits, vegetables, and whole grains to help shape a positive food preferences and encourage eating habits that focused on vegetables, fruits, and whole grains, steering children away from ultra-processed foods and sugar-sweetened beverages. The overall outcomes of the studies are shown. There was a better staff-child interactions during mealtime, suggesting that children were more willing to try fruits, vegetables, and whole grains, and overall changed their perception of the following foods. Furthermore, the intervention's effects among nutrition education and the environment also improved by the staff learning about nutrition and help educating the families as well, which promoted more healthy behaviors. However, there was no significant change in intervention among the child level. This is primarily because the children could have been too young to understand the importance of nutrition, and this study would have saw bigger improvements if it was focused on elementary and upper level education. Overall, there was an improved nutritional policy and practices. This suggests that the center continued to expand their nutrition knowledge by teaching families and students, as well as participating in nutrition promoting activities. Overall, throughout the studies, I have concluded that school meal intervention can have a positive effect on decreasing the prevalence of childhood obesity by providing adequate nutrition. Here, emphasizing the fact that children are now receiving more whole grains, fruits, and vegetables instead of receiving ultra-processed foods that are at their convenience. Furthermore, emotional regulation could have a positive effect on childhood obesity by providing coping mechanisms that avoid consumption of added sugars. It is evident that many people soothe themselves with food. Between ultra-processed food, sugar-sweetened beverages, and foods that contain lots of added sodium, it is important that people understand the harmful effects of these foods and how developing different coping mechanisms can help support them in a healthy lifestyle. Lastly, nutrition education is a necessity in educating people how to actively prevent obesity in youth. Building a positive relationship with fruits, vegetables, and whole grains can help prevent childhood obesity. By providing nutrition education to families of young children, it will help them encourage their kids to develop a healthy relationship with whole foods and view them as something to benefit them, rather as something they do not want to try and see as gross. It is important to understand that all of these interventions can help decrease the prevalence of childhood obesity. However, it is necessary to help increase the availability of fresh foods to communities instead of making ultra-processed foods the most convenient ones to get.